Hello, you guys. I am Dr. Talia Marcajani, and I'm recording to you guys from my clinic in Bloorworth Village. And today I want to talk about some myths about naturopathic medicine, especially regarding our relationship with conventional medicine and medications. And in order to talk to you about that, I want to talk about something called the therapeutic order. So the therapeutic order is from our traditional roots in the formation of the profession of naturopathic medicine. This is one of our philosophical ideas about how to treat somebody that comes in our door and how people should be treated in terms of the medicine that we practice. And this is a 7-step process or a hierarchy of what our treatment goals are for seeing somebody. And the reason I'm relating the therapeutic order to medications is because one of the steps in this hierarchy of the therapeutic order is pharmaceutical medication. And so I feel that in naturopathic medicine, most of us, and certainly in our philosophy, when in regards to medication, it's not that we don't agree with medication or surgery or conventional treatments. It's our agreement about when they're implemented, and it's also about our efforts to treat patients before the need for surgery or medications arises. And so the therapeutic order is a system of interventions, and we go from lower force interventions to higher force interventions. And the first step in the therapeutic order is to remove obstacles to health. So anytime somebody walks into my office and is displaying certain symptoms, I'm always looking for what are the obstacles that their body is facing when it's trying to achieve its optimal state of health and wellness. Our bodies have evolved over 300 billion years to, from whatever our common ancestor was that first created life. And, so we're this result of a lineage of survivors if we're here on the planet today. And so our bodies have evolved amazing mechanisms to preserve our health and well-being, to ensure that our genes are carried on to future generations. So when somebody is coming in the initial stages of disease, and so this may manifest for you as just this subclinical feeling of imbalance, for lack of a better word, there's often an obstacle in the way, and a big obstacle that often presents itself in my patients' lives is stress. That's one that's huge, and that's a reason that I talk about that so often. Another are toxic burden from our environment. Things like pesticides, plastics, smog, pollutants in our air, in our water, in our food, that can also cause an obstacle to health, or just give our bodies some extra things it has to deal with that divert it from its job of making us feel and look our best. And another thing, of course, is diet that's inadequate, that's not providing us the nutrients that we need, or a diet that's providing us with anti-nutrients, so it's preventing us from absorbing the vitamins, the minerals, and the macronutrients that we need to function optimally. And some naturopathic doctors will focus on the energetic aspect, right? The spiritual aspect. So is the person in front of them pursuing a meaningful life? Do they feel satisfied with their work? Are they satisfied with their relationship? So anytime one of these major pillars of our health is lacking, that can also present an obstacle to us feeling our best. And oftentimes the obstacle is a mental emotional one, even if the symptoms that are manifesting are physical. So another video that explains this is my Wheel of Balance video and talking about stress. And when I work with mental health, a stage to mental health promotion is emotional wellness, which is why I use that term so often. Rather than focusing on eradicating or eliminating or managing symptoms of mental illness, or I prefer to say mental health conditions rather than mental illness, how can we improve our emotional wellness? How can we improve our mental wellness, as opposed to focusing on disease? Most naturopathic doctors will focus on this level. This will be inherent in our philosophy. We're always going to be looking for what the obstacles are that are in the way of our patients achieving a symptom-free life, or a life of low or no symptoms, and a life of abundant wellness and energy, and healthy weight management and healthy mood, and all of the things that indicate robust health. This will always be inherent in our philosophy. The second step in the therapeutic order is to stimulate the vis. So this is the vis medicatrix naturae, which is Latin for the healing power of nature, which may seem a little bit woo-woo to some people, but you can think of the vis as metabolism or homeostasis, and this is the idea that our body is primed for optimal health, and our body is always striving to maintain balance. And there's this idea in naturopathic philosophy that sometimes this inherent energetic mechanism that causes life in all living beings, and that sometimes it needs to be stimulated. And oftentimes the therapies to do this are more in the energetic realm, so things like homeopathy and acupuncture and hydrotherapy as well, so using water and various temperatures to increase metabolism and hormonal balance and homeostatic balance and blood flow. So those are all sort of scientific terms for what I think the vis attempts to describe. So I tend also to use diet in this realm and herbs. I believe that herbs, and there's some research for this, some evidence that herbs are modulating, that herbs, as opposed to drugs, kind of seek where things are lacking, and they balance our hormonal milieu, our hormonal landscape, more than a medication, which is man-made. And an example of this is that some people supplementing with straight vitamin A experience some negative outcomes in large studies that were done. But if you eat foods that are high in vitamin A, that those negative symptoms from vitamin A supplementation seem to balance themselves out, and that's because there are some nutrients present in vitamin and nutrient-rich foods that we haven't discovered yet, and that seem to act synergistically with other chemicals and natural chemicals that are present in those foods. And so, by taking nature into our bodies through forest bathing, so physically being in nature, or through the consumption of plants and natural substances, I believe that we receive some of those messages from nature. And I can get into this in future videos, but I find that herbs have some intelligence behind them, and that's not necessarily woo-woo or pseudoscientific. There's some research for sure that show that herbs modulate through their anti-inflammatory effects, their antioxidant effects, and their hormone balancing effects in ways that pharmaceuticals don't do to the same extent. And so at these two stages, when patients are coming in and we're focusing our treatment on removing obstacles and stimulating the body's capacity to heal, and you can think about this, right? If you break a bone, we're definitely going to remove the obstacle, which is whatever broke the bone in the first place, and then we're going to promote the body's ability to heal. It's not conventional medicine that heals the bone. We simply align the bone so that it can fuse together. It's the body that heals it. So we would be promoting the healing of that tissue with some of the nutrients that the body needs. So this can be applied no matter how serious the medical condition, but definitely will always be sort of implicit in our treatment plans and how we look at the body. And sometimes that's enough. If somebody is just coming in with a general feeling of imbalance, or someone who's coming in a good state of health without lots of apparent symptoms, that just wants to manage their health in general, then we'll kind of stop there. We might teach you some ways to detoxify and to encourage healthy diet and the healthy consumption of health-promoting foods, and we'll let you sort of maintain that on your own. But what often happens is that people are coming in, because we've been taught in our culture in North America and Canada especially, to come in and seek medical care when we're feeling ill. A lot of the time people will come in with some kind of issue, so some specific symptoms. And oftentimes these symptoms are apparent or located within one organ system. And so the third step in the therapeutic order is to strengthen weakened systems. So this might be somebody who's coming in with a liver issue, and this may be a diagnosed issue, or based on their symptoms, we're noticing some impairment in the liver in general. And so we take treatment a step further and we start to focus on actually repairing the tissues that are present in the liver. And so we'll be using some, perhaps liver detoxification, some more intense diets, so diets that are geared more to therapeutics, and using some herbs and nutrients to clean out the liver. We can also use some of our energetics at this stage, so acupuncture, homeopathy, hydrotherapy, self-care practices, and we'll definitely be removing obstacles to cure, so high sugar diets or overconsumption of alcohol, or a high toxic burden. We'll be looking at those things as well, but we're also taking a step further and specifically focusing on the liver in this case. And this is something that I see most of in my practice, is people coming in with a hormonal imbalance, with a mental health condition, with digestive issues, skin issues, hair falling out. And so we're ordering labs, we're targeting specific organ systems, and we're maybe not necessarily putting these symptoms into a diagnostic category that would be diagnosed by a conventional doctor. So sometimes these are still subclinical, but there's definitely symptoms present. People are suffering and they're noticing a change, and they probably have already sought help with their medical doctor, and maybe were told everything was fine, or maybe they received a diagnosis. The fourth stage in the therapeutic order is to correct structural integrity. So if our posture, if our alignment is off, then our health is not going to work properly. There's not going to be proper nerve conduction, there won't be proper circulation, there won't be proper functioning of our organ systems. If our, rib cages collapse, we won't be breathing properly, and we won't be oxygenating our tissues. If our pelvis is out of alignment, we won't experience proper digestion and digestive regulation. And I often refer out for this stage. I might refer to an osteopath or a chiropractor, physiotherapist, or massage therapist. I might do some acupuncture myself, but typically for structural correction, I'll refer to another practitioner. And I myself see, massage therapists, chiropractors, osteopaths, and do quite a bit of hydrotherapy and work on aligning my body through yoga and things like that because of its importance in just general health maintenance. Oftentimes, while this is the fourth stage in the therapeutic order, I often recommend that it be implemented as some kind of healthcare strategy that focuses on structural integrity, be implemented early on or as a maintenance, especially because we're so sedentary and we spend so much time in front of our computers, and often engage in repetitive exercise. Working on structural integrity management is so important. The fifth stage in the therapeutic order is the use of natural substances to restore and regenerate. And so this is a little bit like symptom management, if you can imagine that. So the objective of naturopathic medicine and it is not necessarily to fix a specific disease, right? Which is often confusing because we have a very disease-focused healthcare system, not necessarily a health-focused one. And so we're sort of indoctrinated into this view that if you don't have a diagnosis, that you're healthy, or health is the absence of symptoms, which is certainly not the philosophy of the World Health Organization, who believes that health is a mixture of our mental and spiritual and emotional and physical well-being, and not simply the absence of disease. However, we do have a sick care system rather than a healthcare system, and so we're sort of educated not to go to the emergency room or your family doctor unless you feel like it's serious enough to warrant a diagnosis. And if it's not, then you're often sent home and told everything's fine. And patients will always come in having told me that their labs are fine, and they're fine in the framework of not, requiring a diagnosis or pointing to necessary pathology, but they're certainly not fine in the sense that there's not things that we can improve on and that are not, giving us warning signals of what could come in the future. We often focus on, disease prevention and manage and healing the body rather than focusing on the symptoms or the pathology. We're looking for the underlying cause. However, sometimes we get far enough along that we do need to manage symptoms. Otherwise, people aren't going to notice benefit. And so further along the disease process, further along the naturopathic order we need to reach to manage the diseases. These are a little bit higher force interventions rather than sort of encouraging tissue repair like we were doing in the third stage of the therapeutic order. Now we're focusing more on, managing symptoms, managing inflammation through herbs that are going to calm it down quickly and, detoxify quickly. And, we're going to manage headaches with herbs that are just generally anti-inflammatory. So we're going to be looking at symptom management. And so a lot of the time we'll do that in conjunction with the other 4 stages of the therapeutic order. But this time there is a heavy focus on keeping symptoms under control for better quality of life and to move the needle further. And the 6th step of the therapeutic order is similar to the 5th, so except that we're using pharmacological devices. And so it's not that we're against pharmacology and medications in naturopathic medicine at all. We simply want to encourage patients to come in and see us before things get to the point where you require medications. And I certainly believe, and I think even many conventional practitioners agree with me on this, that medications are probably too widely prescribed or overprescribed, right? And this may be that there are no other solutions, and as a clinician you want to help the person sitting in front of you and aren't really sure how to go about that. So if somebody comes into your office who has depression, you're going to reach for the selective serotonin reuptake inhibitor, the SSRI, the Prozac or Cipralex. You're not going to tend to risk using herbs or focusing on diet or digestion or those kind of things. You're going to use this quote unquote proven method and you're going to implement that right away. Whereas my philosophy would be to, depending on how serious the case is, to implement other interventions and make sure that our terrain is being treated, that we've removed some obstacles to cure, we've encouraged sort of spiritual and life meaning pursuits, and we're stimulating the body's own healing mechanisms and anti-inflammatory mechanisms, and that maybe we're directly targeting the brain with some nutrients and some vitamins, and that we're making sure structural integrity is there, and that we're even using some herbs to manage depression, because we know St. John's wort, it works very similarly to an antidepressant in terms of its efficacy. And then, if those things are not working or not having enough of an impact, then we might talk about an SSRI, depending on how severe the case is. And I say this not to create a stigma around medication use at all. Every single body is different, and everybody's going to need a different treatment concoction, and it's never going to be just one treatment, or very rarely will it just be one panacea. No matter how much we wish that there were, it's going to be a few things that we need to implement to help manage our own health. So that's when we'll reach for the pharmaceuticals, right? When the natural treatments are not having enough of an impact, or the disease process has progressed far enough. And then the last is the use of high force interventions, so surgery, radiation, and chemotherapy, right? So when when you're diagnosed with cancer, then it's definitely appropriate to do radiation and chemo, or to excise the tumor, or if there's joint degeneration to the extent that it can't further be repaired and you can't sort of prevent it because you've reached the point where the cartilage in your joint is damaged, then a joint replacement is appropriate. But it's not that we're against these things either. It's that we believe in trying as hard as we can to prevent them from being necessary. But when appropriate, they're definitely a gift that we have in our culture and in the time that we live in, that we can use these kind of things to improve our quality of life and to get us back on track in terms of our health. And so very rarely will I see somebody who requires this stage of intervention. Even naturopaths that work with cancer, their focus is not to treat cancer with natural therapies, but to support the whole patient and to improve the outcomes of the high force interventions. Often an obstacle to healing from cancer is that patients aren't able to finish their course of chemo due to the side effects, and so a lot of the natural therapies can help boost the efficacy of the medication and reduce the side effects and make patients feel better, so that they're able to complete their treatment and then have better outcomes. So at the last 2 stages where we're using medications and high force interventions, natural medicine is working to support the terrain, to support the body through the therapies through the side effects and to also encourage the therapies to work better. And just to recap, the stages of the therapeutic order are: first, number 1, remove the obstacles to health. Number 2, stimulate the vis medicatrix naturae, or stimulate homeostasis, improve our body's self-healing mechanisms through applying nutrients or looking at energetics or using herbs to balance our systems and promote proper hormone balance. And the third is to strengthen weakened organ systems, focusing on one organ that may be the culprit in causing symptoms in particular, and really using nutrients that target that organ and the tissues that that organ has. Number 4 is to correct structural integrity. So creating a proper alignment and healing the musculoskeletal system through things like chiropractic medicine, osteopathy, massage therapy, even hydrotherapy, and acupuncture. Doing exercise like yoga as well fits under there. And number 5 is to use natural substances to restore and regenerate. So this is using natural substances to work on directly with symptoms and to promote healing, but in patients that are further along the road to pathology and maybe already have a diagnosis of some health condition. And number 6 is to use pharmaceutical substances to halt progressive pathology. So these are palliating, they're stopping disease, they're treating somebody who is either not responding enough or whose disease has progressed far enough that natural therapies are no longer strong enough. And then the 7th stage of the therapeutic order is to use high force invasive modalities such as surgery, radiation, and chemotherapy. And again, these are removing the disease. Often that stage is where it's usually life or death situations, right? We're working to remove what's causing a danger to our body and to our ability to survive. And so naturopathic medicine it sort of covers this whole spectrum. We have therapies that cover the whole spectrum of this, of these stages, and we're working to treat the whole person, not focusing on the disease or the symptoms, but looking at the person in front of us and taking into account their lifestyle, their preferences, their unique individuality and genetic expression and individual expression. My name is Dr. Talia Markajani. I'm a naturopathic doctor, and I work at Bloor West Wellness in Bloor West Village in Toronto. Take care.